Today we're going to study about another important topic in conjunctiva, that is phlyctenular keratoconjunctivitis. First topic we're going to cover is the introduction. So what is phlycten? Phlycten is basically a nodular affection. It is a nodule which occurs as an allergic response of the conjunctiva and the cornea to some endogenous allergens to which they have become sensitized. It is believed to be a delayed hypersensitivity, which is a type 4 hypersensitivity reaction in response to endogenous microbial proteins, and so it is also called as microbial allergic conjunctivitis. The most common microbial proteins are the tubercular proteins and staphylococcal proteins. The age group in which this most commonly occurs is 3 to 15 years. Disease is more common in undernourished children. The next topic that we are going to cover is the pathology of the disease. There are 4 stages in which this disease progresses. The first stage is the stage of nodule formation, in which the exudation and infiltration of leukocytes into the deeper layers of the conjunctiva occurs, because of which the nodule is formed. The second stage is the stage of the ulceration, in which the necrosis occurs at the apex or the tip of the nodule, because of which the ulcer is formed. The third is the stage of the granulation. Eventually, the floor of the ulcer becomes covered by the granulation tissue. And lastly, the stage of the healing, which occurs with minimal scarring. The clinical features of the disease are, firstly, the symptoms, in which the patient experiences irritation, reflex watering. And what are the signs? The signs are a typical pinkish white nodule which is surrounded by hyperemia, which is seen on the bulbar conjunctiva, usually near or on the limbus. The second sign which we can see is the ulceration of the nodule, and third sign which may be seen is the phlyctenular keratitis, which is basically involvement of the cornea, in which we can see the inflammation of the cornea and blood vessels progressing towards the cornea. How can we manage this disease? Firstly, local therapy, topical steroids in the form of eye drop or ointment. It actually shows a dramatic response to topical steroids. Secondly, antibiotic drops and ointments. And thirdly, atropine 1% eye ointment can be used when the cornea is also involved. Second, specific therapy like anti-tubercular treatment or systemic antibiotics for any septic focus. We also need to rule out the parasitic infection. Third, general measures to improve the health of child by providing high protein diet supplemented with vitamins like A, C, and D.